there is no shortage of health awareness on the internet, but still, it is not apparent that the health of the society is improving. That the information and action are two different things. Just information consumption does not lead to action, and when there is no action, there is no benefit, obviously. For this reason, we have our life, there has to be mass awareness, but awareness will not translate into action. So, we intend to form small pockets. For example, the basic units of society, that is a family. That one person, at least one person from this small family of maybe 5 people, or a workforce, a work team of say 10 people, or a friend circle of 5 people, from that at least one person becomes aware of health situations, health conditions, things that have to be done for improvement for themselves, and also teach this to their friends and family and workmates to improve the overall health. And with this improvement of small pockets, our firm belief that the entire community can be improved and community can be helped. Now, let us see about the information, the knowledge that you must have in order to improve your health and your family's health. The first and most important part is to understand nutrition. In nutrition, you have to understand what is a balanced diet. Diet is the diet which has a proportional quantity of all the nutrients. That means carbohydrates, proteins, they all have to be in appropriate quantity. Now, what are that all we will discuss in coming videos and in our training program. But for now, important is word balanced diet. The food has to be balanced. The next, we move to portion control. Overeating, even of healthy food, is not good. It makes you unfit. That's why you have to pay attention to the portion sizes that you eat. Next is the hydration. Hydration, that is water consumption, is very important. You should at least aim to drink 8 to 10 glasses of water every day. Now, of water, at least 3 liters of water in summer days is required. Let us next talk about the physical activity. Now, physical activity, in my view, is a very easily modifiable condition. You have to move more. You have to have at least 150 minutes of moderate intensity exercise or 70 minutes of intense activity per week. It is not too much, but still most people or the majority cannot do that. This can be done. You have to focus on doing at least 150 minutes of moderate exercise or 75 minutes of high intensity exercise every week. For example, walking, cycling, swimming, even dancing is a good exercise. We have to work on strength training. That means to build and maintain muscle mass. That can be done twice. To reach flexibility and balance, yogas, pilates, and simple stretching routines are very. So after having talked about nutrition and physical activity, let us talk about another important factor, that is mental health. This mental health condition or mental health awareness have been long ignored over decades. But now people are getting more aware and realizing that mental health is related to physical health. And we talk about mind, body, and soul connect. So mental health, most important nowadays is stress management, because stress has effect on heart, it increases blood pressure, it increases diabetes, and many other conditions are worsened by stress. That's why how to maintain stress or reduce stress, that is important. I'm not saying one must not have stress and you should become a monk and live in the mountains. No, stress has to be there, but it has to be maintained and regulated. And those techniques you must learn. Next is the sleep quality. Sleep is again related to health in a form of stress, because reduced sleep or lack of sleep increases stress, and that in hand. That is why sleep is very important. People who have sleep disorders, sleep problems must learn to follow or build sleep routines, most importantly, or change the environment and how they can improve their sleep. That all will also be taught in our training. About healthy habits like reduction of alcohol and tobacco consumption, those are the well-known facts that we need not emphasize more upon, because we know all that. Only problem is that we know that, but doing it in action is problematic. So there comes the factor of behavior change, that how one can change their behavior to reduce these vices from their lives and improve their health and the family's health. This also has a effect on your. And most important thing that cannot be taught by non-doctors is the first aid, or the things that's emergency medicine, like not medicine, but emergency steps that one must do in such certain conditions before you actually receive medical help. Those things will also be taught in our training. If you feel such a training program might be useful for you, then write in the comment section that if you would be interested or what things you would like to know or would like to be trained in such training programs, and we will see to it that that is inculcated in the practice. Like this video and share it with your friends and colleagues who you think would be interested to learn more and train themselves for better health for themselves and their families. See you in the next video.